In his State of the Union address, President Biden announced an ambitious plan to address the country's mental health needs, presenting it as an issue with bipartisan support. Let's get all Americans the mental health services they need. More people they can turn to for help, and full parity between physical and mental health care if we treat it that way in our insurance. On Tuesday, the White House also released a fact sheet that lays out details of the administration's strategy. It seeks to address a mental health crisis which has been years in the making, but was only worsened by the pandemic. The plan focuses on ways to strengthen system capacity and connect people who need help to a continuum of care. It includes measures to expand the mental health care workforce, efforts to establish a crisis care response system to support the launch of the 988 crisis line in July, a focus on children's mental health and proposals to push insurance companies to improve their coverage of behavioral health work. We have needed a bold national strategy for a long time, and we're just pleased to see that the administration is taking this opportunity. This has been long in coming. This is the first time since the Carter administration that the federal government has taken such significant leadership in addressing mental health, says psychiatrist and former director of the National Institute of Mental Health, Dr. Thomas Insel. I think this is it. For the most part, the federal government has ceded mental health policy, and services to the states. Essentially, the federal government has been missing in action for 41 years, and Biden's comments in this fact sheet bring it back into the center of the action for mental health. Insel and other advocates' excitement also extends to the specifics of initiatives spelled out by the White House. But they say the success of the plan depends on congressional support for the regulations and funding proposals outlined by the administration. It's particularly important, says Stribling, that lawmakers consider long-term funding. This cannot be a one-time intervention from the federal level, Stribling says. This must be a sustained and broad-based response. The mental health impact of the pandemic, Stribling adds, is going to have a very long tail. And we need to remember that we had a pre-existing mental health crisis before the pandemic. We're talking about addressing decades worth of declining mental health in our country. Still, the president's focus on the mental health crisis, and recent signs of bipartisan support for addressing it, are very encouraging, says Insel. I think for the first time in a very, very long time, we have